It's Wednesday night, the day before my surgery. It's about 8 o'clock in the evening. This month I'll be 65, and tomorrow Dr. Murphy will be performing a total hip replacement on my right side. It's my second replacement. I had the left hip done in 2017. It's going to be outpatient. I'll be going home the same day.
A typical experience here at North Atlantic Surgery Suites involves a patient coming in with a family member. Usually the first couple of patients arrive relatively early, sometimes before sunrise, meeting the staff outside, coming into the pre-op area, and meeting the nursing staff and anesthesia as well as the surgery team.
So like I said, this could go on either leg. All right, come on.
I would come and meet with him and do the surgery consent, sign the incision area, answer any questions that he has, double check if there's anything unusual about the leg length difference between the two sides. So we just roll down the hall and into the operating room and then move him over to the OR table and turn him on his side. Surgery technique and anesthesia technique are very important. When we do surgery, everyone on the surgery team stays for the entire operation. What we do here is when people are on that operation, they're there the whole time, everybody is focused on that patient. To have a facility like this with 90% joint replacement, there's no other facility in New England that is that specialized. We can focus very specifically on excellence in a particular area, which is very helpful.
Anthony Khalil, date of birth 2/15/54. Consent is signed for right hip. Total prior risk of 2. Everybody agreed?
Yep.
Thank you.
So then we go ahead and do our surgery and make the exposure, put the implants where they belong, and then close. We very often have the same nurse check the patient into pre-op that takes care of the patient post-op, so you don't have to meet a new person, they already know you.
It's good to know that you're waking up to a familiar face that you've already had a bond with. We want to promote rest, we want to control any pain you may have or any other symptoms. But usually you're pretty awake within the first half an hour of coming out of your surgery.
Hey! All right, how do you do? Fantastic, awesome.
I brought my husband Anthony in today for a total hip replacement, and we're in recovery right now, and he's doing fantastic. He's been out of surgery for about an hour and 15 minutes. He's sitting up, he's joking, he's getting the feeling back in his feet, and getting ready to go home, which is fantastic. And the staff here is wonderful.
We have a practice set of stairs here that we review, and we have patients demonstrate that they can use them safely and properly. We do have physical therapy that comes to the patient's home the next day.
There are a lot of advantages to having joint replacement as an outpatient procedure. Firstly, it means that people are doing a really good job. If you feel well enough that you can go home a few hours after an operation like that, that means that everyone in the process did a really good job of taking care of you. At this point, with specialized outpatient facilities, you can achieve a level of care that cannot be accomplished in a hospital environment. I think that you need the right patient, but most patients are the right patient. Well more than 50% of patients who need joint replacements could be treated easily with day surgery. I like working here because everything is done exactly the way it ought to be done to maximize the opportunity for a patient to do well. And we've really worked very hard to refine every aspect of the patient's care.
Our patients actually get to go home and recover at home. They're less likely to be exposed to infection. They get to sleep in their own bed. Our patients do really well.
Well, the day started early this morning. We were at the center at 6:15. His surgery was about an hour and 15 minutes. By 10 minutes of 11, he was sitting in recovery. I got to see him. He was eating and talking, moving his legs around. He looked great. He's happy. He's alert, pain tolerable, and the experience was like going to your doctor's office.
I think this was better than the last time I had hip surgery. Having the day surgery and coming home, I didn't know what to expect. Now I'm just sitting here, alert. You know, I do have pain. Naturally I would. I had surgery, but I had pain before the surgery. At least now I know the pain is going to gradually get better, you know, with the therapy, and it's going to heal.